Hi, good afternoon. I'm Kelly Bertus. Tonight I'm going to perform two checkoff subcutaneous and intramuscular ones. Um, I'm going to start with the sites of each checkoff. I'm going to start with the subcutaneous. Okay, the sites for the injection for subcutaneous we have the posterior, uh, the outer posterior of the aspect of the upper arms. We have also the the abdomen area from the costal margin to the iliac crest, and then we have also the anterior part of the thigh. For intramuscular, we also have the ventrogluteal is we have to locate the crest for the iliac, and then we are going to do a little angle, and this position is the intramuscular um, sides for ventrogluteal. Also we have the bastolateral is the same type but in the side, and also we have the most common, the deltoid is in this part. We have to locate the acromion, and then two fingers up, two fingers down, and in the middle is going to be our sides for intramuscular. Okay, now I'm going to start my checkoff. First, I'm going to sanitize my hands because I'm going to be in the medical room. Okay, first I'm going to check in Mars what we have the medication for my patient. Okay, let me see. I printed all this stuff. Okay, this is Mars. I have to look all the Mars to see what medication has at this time of the day. The ones I'm looking for is the subcutaneous intramuscular. Okay, I find the in subcutaneous I have B12, B12, and for the intramuscular I have influenza vaccine. Okay, this is my patient is Anna Pawlowski. She has allergy for penicillin and the reaction is hives. Okay, I'm going to compare with medical orders. I printed out two. I found that has this the B12 is matched with Mars, and also let me see what is and also has the influenza vaccine is matched with my Mars. Okay, now I already washed my hands. I'm going to already wash my hands. Now I check the allergy for my patients. I'm going to retrieve my medication for the medical card. Okay, when I retrieve my medications, I see that has two vials. Okay, I have to do my first check in these two. What is my first check is have the right patients. This Anna Pawlowski. I have for subcutaneous vitamin 12 is 0. In the order say 500 mcg, but I have to convert this when I do my calculations for ml because my injections my injections is my syringe is in ml. Okay, for now I'm going to say 500 mcg. If the route is subcutaneous, the time is at 1600. This is every month. Okay, to this day. This is June 17, 2020. For the intramuscular, I'm going to use this vial, this another vial. Okay, this is for influenza vaccine. I have the correct patients. The correct dose is insulin, influenza vaccine. The dose intramuscular is 0.5 ml as a order. Yeah, I don't have to do any calculation on this one. The time is at 1600. I'm going to document the both when I give them. Okay. Um, I has to check for any expiration. Is not expired. Actually, if it's not expired, either this one or this one. The vitamin B12 and the influenza vaccine. I have to check in my. Okay, I have to check. I have to write down because my printer it wasn't working. I write down my med card to be aware what is the side effects for each one. For influenza vaccine is the most common they use for prevent any strongest side effects for the flu. We have to watch for any allergies, the reactions, the side effects for this particular for the influenza vaccine intramuscular is going to decide when I'm going to give you my patients. Is going to see if it has soreness, redness, swelling, it's systematic. He came, have fever, nauseous, muscles ache, and fatigue. For vitamin 12, this I'm going to give you by SubQ. Is for deficiency of vitamin B12 and has to monitor plasma folic acids, iron levels, and potassium levels. The side effects for B12 could be red urine, rash, erythema, and hypertension. I have to watch the blood pressure for my patient. Okay. I did my med card. Now I'm going to do calculations. Um, just for reminder, for intramuscular, the influenza vaccine is not need calculation for now because it came as prescribed. And then, but for the B12, I said when I did my first write, that's the amount is 500 mcg, but has to convert to ml. Okay, I did my calculation in this table. Basically is this is the order. That's how the medicine came. I don't know how the medicine came, and then I has to divide 500 mcg over 1000 mcg times 1 ml. If they give you the amounts I'm going to inject to my patients is 0.5 ml. Okay. Okay, I has everything. I did my first check. I did my calculations. I'm going to select my needles. Okay, for selection my needle for intramuscular, I'm going to use a 3 ml. There's a 3 ml syringe with 22 gauge needle. Okay, for my SubQ, I'm going to use 1 ml syringe with a 25 gauge needle. Okay, I'm going to do my second check. In my second check, I'm going to with my medicines. Yeah, here we go. I have Anna Pawlowski for both of them. For CQ route, I has B12. I'm going to give you 0.5 ml. The route I say is a subcutaneous, subcute. At the time is at 1600. Yeah, at 1600. For I'm going to document when I giving. For intramuscular, I has influenza vaccine. it has Anna Pawlowski. The raw is intramuscular. The time 1600. I'm going to document it. Like has patient's name, Anna Pawlowski. The major influences, the route intramuscular, the amount is 0.5 ml, and the time. Okay, and documented. Okay, with that said, okay, I has to start cleaning up my stuff. I has to wash my hands again because I still in the medicine room. Oh, for choosing the injections, the injections and the needles, I use the product, the Seminole State College Injections Guide, to be able to choose the sites and also choose the needles that I'm going to use. Okay, I'm going to keep my what is that? Okay, I got you. I'm going to keep my Merck cards because I'm going to teach my patients later on what I'm going to give you for now. Okay, now I'm going to prepare my vials. For the vials, we need first open each one. Is a first open the influence vaccine, is a first open the B12. I has to put the day, the time, and my initials to be, because this is a multiple use vials. Okay, let me just go ahead and start. I has to now for start clean up my and retrieve my medications. I just need now for now alcohol path. I open it and clean up the top. Rubber of each one. Rubber of each one. Okay, I discharge this stuff. I'm going to use this book to be, you'll be able to see all the process. Okay. Okay, now I'm going to start with vitamin, with the influenza. That's what I say. When I finish doing that, I has to basically put my patient's name. I has to label the syringe. I has to put my patient's name, then the name of the medicine I'm going to give, the amount is 0.5 ml, my initial, the day and the time I'm going to give it. This is 1600. I'm going to start with the process to fill up my injections. I open in butterfly motion. Okay, I'm going to put my cap here. It has to be air to air. I'm going to just use 0.5 ml air to air injected into my vial. Inject the air, switch. I just have to catch the 0.5 I need. If I have any bubbles, I have to just tap it, or I can go return the liquid. I go back to be able to have any air inside. Okay, I switch, I take it off and recap without touching because I don't wanna have any accident. Okay, this done. That was influence for intramuscular. Now I'm going to use the same with vitamin 12. I already cleaned out the top, butterfly motion. Okay, I'm going to put it there, cap here. I'm going to catch the air because I just need 0.5. Okay, insert to here to the vial, air to air, switch. I just catch the liquid that I need, or the medication that I need. Okay, perfect. I catch and recap without touching. Okay, now as the same I did with this one, I put it in my patient's name and B12, vitamin 12 that I'm going to give you intramuscular, subcutaneous. The amounts is 0.5. My initials, the time, the date, and the time I'm going to give you. In both is labeled. Okay, let me put this away. I need all my supplies for the injections before I go to my patient's room. I'm going to be my injections. I'm going to do my injections. I need gloves, alcohol pad, my 2 syringe, and my disposable container for my needles. I knock the door for my patient. Wash my hands. Hi, how are you? I'm Kelly Spertus. I'm the nurse student for today. Can you please give me your name and date of birth? I'm Anna Pawlowski. Let me check. Mars. Okay. I'm Anna Pawlowski. What is your date of birth? Is 6/13/57. Miss Anna, do you have any allergy? Yes, I do have allergy to penicillin. What happens when you have the reaction for penicillin? I have hives. Okay, so I'm going to let your doctor know about your reaction for penicillins. But now, Miss Anna, I'm here to give you 2 injections. The one is intramuscular. This is for influences, is yearly. If when I put it after that, if you feel any redness or swelling in the part that I'm going to put your injections, if you have fever, nausea, I'm going to watch closely what the reaction that you have. And also I'm going to do subcutaneously the vitamin 12 is a monthly that you are going to have. This is for your deficiency in vitamin B12. Has to watch if you have any reaction for hypertension, and also let me hypertension, any rash, any erythema, or any red if your urine came out red. Okay, this is the 2 medication I'm going to inject today. Okay, Miss Anna. Okay, let me now secure for safety. I have to make sure that her bed is in the lower positions, the cervix is up, the collar is reachable, and she is not moving. But for now, to be able to work with my patients, I'm going to put it in the highest position for me to be able to perform my injections. Okay, I'm going to close the door for privacy. Okay, before I start the injections, I'm going to assess. I'm going to do any assessment like a blood pressure, whatever it can indicate me that the patient is not going to came after the injections came something abnormal or unexpected. Okay, now let me wash my hands again. Let me put my gloves. Put your gloves. Oh, before I put my gloves, I have to do my third check with my patients. Okay, I'm going to make sure that I have my for influence. I'm going to use the intramuscular injections. This is annually. I have Anna Pawlowski influences vaccine. The Ross intramuscular. The time is at 1600. What else? patients Anna Pawlowski, the raw is intramuscular, the is for influenza vaccine, the time 1600. I'm going to document it. Okay, and also I'm going to do my third check in the vitamin 12 is for Anna Pawlowski vitamin B12 0 0.5. Okay, for bio is also for influence is also 0.5 ml. This is the amount. And also I has to the rosin subcutaneous. I'm going to use 1600 tonight. The size I choose for both for subcutaneous, I'm going to use her abdominal area. For intramuscular, I'm going to use the deltoid muscles. Okay, wash my hands, put my gloves. Let me point. This is a clean gloves that I use. Okay. This is a clean gloves I use it. Okay. I need a alcohol pad. Open it. I have to clean up from the center and circular motions out there. Circular. Okay, I have to let it dry, air dry, and then and right now I'm putting my patients in the lay down position because that was the initial position that my patients has. I'm going to do the subcutaneous vitamin 12 injections. Okay, I'm going to open as a needle with my not dominant hands. I'm going to pinch, insert in 90-degree slowly, take it off and release. I just put a gauze in the top. I don't have to rub it. Okay, I'm not going to secure because I'm running out from supplies. I know I'm going to, for safety needle, I'm going to dispose in my needle container. No recap. Now I'm going to, Miss Anna, I'm going to change your positions. I'm going to put in sit down position because I'm going to do the put your influenza vaccine. Now I'm going to use intramuscular. I'm going to use the intramuscular technique. As the same, I has to clean up my sides with alcohol pad in circular motions like this, from the center to the outer. Let dry, air dryer, and then I have to use the technique with zip pack. The zip pack is written in this way, but I need recap. Open it. Okay, with my not dominant hands. I'm going to do the zip pack motions in 90-degree. I'm going to inject. Okay, slowly. Safety, I'm not going to do because I'm running out of material. Release. I put in the top a gauze, no massage, and this is going to be in my needle container disposal. Okay, Miss Anna, I'm going to now, how you feel? That was painful? No, just a little bit. Okay, Miss Anna, let me grab all my materials that I use. I put in the way they has to put it this back to my medical room because they stay in the medical room because these are multiple use vials. She maybe later on can use that again or another use for that. I take it on my I take it on my gloves. Okay, I put it back this in positions. Okay, I clean my area. Okay, I have to ask my patients. Okay, Miss Anna, how you feel? You feel comfortable? Let me put your bed in the lower position. You sat around up. Your cold base is reachable. Miss Anna, do you need something else that can reach you before I leave? No, this is fine, Miss Girl. Okay, Miss Anna, let me just check stay with you so a couple of minutes to see if it has any reaction for the injection that I just give it to you. Um, and then let me document them as a given for both injections for vitamin B12 and influenza vaccine. Also, open the door because it's no more any privacy. I wash my hands and thank you so much. That's my checkoff for intramuscular arm secure injections. Thank you.